5 lifestyle changes that can help lower blood pressure.
What is high blood pressure? High blood pressure, also referred to as hypertension, is when the force of blood through your vessels is consistently higher than normal levels. Some causes are increased stroke volume and cardiac output, vasoconstriction, and hypervolemia. Lifestyle changes to reduce blood pressure means blood pressure is being reduced naturally, not medicinally. Regular physical activity is a factor of a lifestyle change to help lower your blood pressure. A problem is blood pressure is found to increase as weight increases. Sleep apnea can become a problem with people who are overweight, which can eventually lead to raised blood pressure. A solution is 150 minutes a week or 30 minutes a day of consistent workouts can help lower blood pressure. Some examples of daily activity can include walking, jogging, running, swimming, and dancing. Regular exercise can lower blood pressure by creating a healthier heart that does not have to work as hard to pump the blood through the body, which in turn reduces the amount of arterial pressure in the vessels.
The second lifestyle change to reduce hypertension is to reduce stress in your life. Chronic stress may affect blood pressure, but additional research is still needed to determine what the exact effects are in the long term. Your fight or flight syndrome, which is when your body is in a stressful situation, causes vasoconstriction, or constriction of the blood vessels. Mayo Clinic and American Heart Association recommend reducing the amount of stress in your life. This leads to an overall healthier lifestyle, which can promote a healthy blood pressure. Ways to reduce stress in your life: you should try to change your expectations by not overloading your day and trying not to do too much in one day. You should then also focus on issues that you can control and work on ways to solve them. For example, if you have issues at work, try to talk to your manager. If you have issues in your relationship, try to communicate with each other more. Another way to reduce stress in your life would be to avoid stress triggers such as rush hour traffic or people that cause extra stress in your life. Make time to relax and participate in activities that bring joy to yourself. And try to show gratitude more often. Gratitude leads to positivity and can reduce stress. By reducing your stress, you can lead to less vasoconstriction, resulting in lower blood pressure in temporary situations, which then can promote a healthier blood pressure in the long term.
Another way to reduce your blood pressure is by healthy eating. So many foods that we like to eat on a daily basis can be high in fat, sodium, and carbs. All these can impact your blood pressure in a negative way. Making changes in your diet can help you put your blood pressure at a more normal range. So some foods to eat would be skim milk, lean meats, fruits, vegetables, breads, rice, pasta, and potatoes. Some foods to stay away from would be butter and margarine, fatty meats, fried foods, canned foods, deli meats, oversalted foods, and whole milk. And these are still things that you can eat, but it's just things that you should kind of monitor how much you're eating. So eating a well-balanced diet optimizes vitamin and mineral consumption and reduces unhealthy cholesterol intake. Various vitamins have been proven to reduce artery stiffness and promote vasodilation.
The fourth way to reduce your hypertension through lifestyle changes is by partaking in the DASH diet. This is recommended by many doctors and stands for Dietary Approaches to Stop Hypertension. Most Americans consume 3,400 milligrams of sodium per day in their diet. A standard DASH diet recommends less than 2,300 milligrams of sodium per day, while the American Heart Association recommends less than 1,500 milligrams of sodium per day for every adult. Too much sodium intake causes water retention in the vessels, which leads to an elevated blood pressure. The solution to this problem is to emphasize fruits and vegetables in your diet and low-fat dairy foods, with inclusion of moderate amounts of fish, poultry, and nuts. When you're shopping, you should choose labels that are 100% whole grain or products with low sodium or no added salt. When choosing cheeses, you should try to choose low fat, not fat-free, because these include high amounts of sodium, or regular cheeses, and foods that are high in healthy fats. A tip for changing your diet to the DASH diet would be to make small, gradual changes in your diet. Find a support group to aid in your success and reward yourself for successes while forgiving slip-ups. You should start with sodium-free spices, flavorings, and sauces. For example, if you're cooking spaghetti, don't add extra salt to the noodles when you're boiling them. Don't add extra salt to your meat if you're having a meat spaghetti. And try to choose a sauce that has an AHA check mark with next to it, which is heart healthy. DASH diet reduces sodium intake, which then reduces excess water retention in the vessels, causing hypervolemia. By doing this, you're promoting a lower blood pressure.
Another lifestyle change to reduce hypertension is to stop smoking. Some quick stats are smoking is the #1 related cause of preventable disease and death. Another stat is smokers who quit below the age of 40 increase their life expectancy up to 5 years, and around 40,000 people die from secondhand smoke inhalation each year. What is the problem with cigarettes? Cigarettes contain an addictive chemical called nicotine. Nicotine is a vasoconstrictor, meaning it narrows the blood vessels in your body. This constriction increases blood pressure and heart rate. Putting all that extra stress on your heart has numerous complications, such as having a stroke or even a heart attack. The solution? Going cold turkey does not work for everyone. You need to avoid triggers that will give you the urge to smoke. Exercise regularly will also help reduce the urge. And the most important thing is to find out what motivates you, whether it be extrinsic or intrinsic. Or it could also be family motivation, whether you're doing it for your loved one or for your children. There are various pharmacological drugs out there, such as bupropion, that reduce urge and block withdrawal symptoms.
Okay, so most of you must be wondering, why do we need to know this? Why do we need to be doing these things? Hypertension is one of the leading causes of premature death worldwide because it is a primary cause of cardiovascular disease. The major complications of hypertension lead to heart attacks, stroke, and heart failure. If you can lower your blood pressure without the use of medications, then why not?